Hey, welcome in all you DPC rebels and resistant fighters. Dr. Shane's back with another Friday 5-minute magic tip coming up on Father's Day this weekend. I want to say a shout out to all my dads out there. Happy Father's Day. Hope you guys have a great weekend. Wanted to share some fatherly advice with you guys today regarding third-party aggregators or patient care management organizations, as a good buddy likes to call them, PCMOs. Third-party aggregators, what the heck is that? What am I talking about? What's a PCMO? What's an aggregator? Maybe you in the DPC realm haven't heard of those or dealt with those. Pretty sure you probably have heard of them. Once I start to explain what these are all about, basically, they are technology companies that exist to connect employers with DPC clinics across broad regions. Let me set it up like this for you. So as DPC continues to grow, more and more employers want the DPC access, especially with the self-funded plans that they use. So they're looking for DPC clinics, and it may be over a broad area, maybe over a whole state, maybe over a region, several states, could be across the whole state as these employers get larger. So they're looking to connect with DPC clinics, and they're needing a way to connect with these clinics in a simplified way. So that's the problem. They're trying to connect with these clinics. The solution is these technology companies that have come in and built the technology around connecting these employers to DPC clinics. And so the employers can punch the easy button and pay these technology companies, and they would feed the money out to the DPC clinics, making it easier to connect with the clinics, and also for the clinics to get paid. So a simpler transaction. Instead of an employer paying 50 clinics, they pay one company, and that money gets fed out. And so, of course, those third-party aggregators, these companies keep some of that money, or they charge their monthly fees a little bit higher, so they keep some of the money for profit, and that's how they become a business. You may have heard some of the companies' names: Appley, Hint Connect, Align, Mending. There are several others. Those are a few that you hear quite frequently. They advertise. They're vendors at DPC events, so you can be looking for them as you're out there on the road and learning more about DPC. Do they work? Can these third-party aggregators help you? Surely they can be helpful, and they can be beneficial, but there's also concerns and things you need to think about. And so I want to share with you several issues and problems that DPC docs have shared with me. I've heard these stories several times, some of them from multiple DPC physicians. So things you should be aware of, some problems that come up with these third-party aggregators. So let me share some of those with you so you kind of get an idea of what you need to be thinking about. Sending sometimes one sneaky thing they've done, heard a DPC physician saying that third-party aggregator worked with a company and had several hundred employees, but they only sent a handful of their sickest patients. So they didn't get 50, 60, 75, a broad range of patients. They were only sent maybe 10 or 12 of their most sickest patients, which was I thought, kind of a sneaky thing to do to the DPC clinic. So be aware of that if that pops up for you. They seen several of the aggregators making folks not wanting to pay if the employees aren't seen 3 or 4 months. So they come in, they get set up, have their initial visit. Maybe it's 3, 4, 5, 6 months. They're not seen in the clinic, and the aggregators don't like that. They want them, I guess, to be seen more often, and so they refuse to pay for several months. Those unseen months, as if the DPC would see them every month or something. So it's quite confusing. The contracts don't stipulate seeing patients that often. So think about that. They heard several people discuss times where they've been basically withhold payments because they didn't feel like the patients were seen enough. Also, hearing from DPC docs that these aggregators are wanting to withhold payment until the patients are seen, which could take months and months. They're getting them signed up, getting it signed up with their clinic. They're registering in the clinic, and the clinic is working to try to get the patients to come in for their initial visits. Sending emails, doing a lot of administrative stuff, connecting, calling, and unfortunately having difficulty getting some of the employees to come in. And then the third-party payers do not want to pay for the work they're doing to try to do that, or the responsibility that they're taking on as basically becoming their primary care physician, whether they're coming in or not. So that contracts don't spell that out clearly. So you have to be really careful about that. So I've heard several docs talking about that. Hearing that they require codes. Some of these aggregators want codes, want proof of how sick the patients are. So they're kind of doing like CPT codes or ICD codes that they won't send in when the employees are seen. So that's something that you need to be really thinking about, whether that's in the language of the contract or required for you to do that. Also, hearing repeated requests to lower their fees. A lot of these aggregators are asking DPC clinics, "Hey, you're charging too much. For employers, you need to lower your fees." So I hear that quite frequently. We've had talks about that before, about not lowering your fees for employers. So think about that as well. So a lot of these things sound a lot like fee-for-service insurance type plans. To me, it's as we go along further and further, making me very concerned that these third-party aggregators are starting to feel like insurance plans, which are exactly what we tried to leave going into the DPC community. So think about that. These companies do have the potential to really help DPC out. They can offer great services, but they're beginning to feel more and more like insurance companies to me. So buyer beware. These are businesses. Read the contracts, get some legal advice to look at these contracts. Don't sign it if you feel concerned about that contract. Make sure there's a way to get out of the contract if you need to. So just consider yourself warned here on this pre-Father's Day awesome Friday 5-minute magic tip. Hope this guy is helpful for you guys, and we'll see you back next week. Until then, you guys keep the DPC magic going.